Hi, I'm Dr. Pamela Stuart, and I'm here today at Physicians Skin Solutions, our office, to talk a little bit about Kybella, the new treatment which is injections for the submental or chin fat that some of us get. The product is a natural occurring chemical. It's called deoxycholic acid, and we find it in our bodies. But Allergan, the company that makes it, found that it also helps lyse or destroy fat cells. So what it is a simple treatment that only takes about 15 minutes in your doctor's office. And here what we do is we put a numbing cream on the patient's neck after we've assessed them and looked at the area that we're going to treat. We then mark it and put a temporary grid on the chin area. And after that, we do the injections, which are very small amounts of the medication. It only takes about 15 minutes total from start to end. And when we do that, the patient will see some swelling afterward. But then over the next few weeks, they'll see those cells and that fat in that area disappear. Some patients will need more than one treatment, but most people find very little discomfort and are very satisfied with the results. Today we're talking about that with one of our patients here as well, and Rebecca has allowed us to film her, so we thank her for that.
Well, I've looked at different options. I've seen in my mother's picture and my maternal grandmother's picture that I can see the progression of what aging is going to do, and I would like to get that a little bit subdued. So when I looked at the alternatives, obviously there's surgical alternatives, which didn't appeal to me at all. And when I explored it and found out that Kybella really was an option, I wanted to see whether that was a viable one for me, and of course you were able to help me understand that was a good possibility. Well, what I understand about Kybella is it is a substance that occurs naturally in the body, which to me was very important, that I'm not introducing something that is a foreign type of an object or a foreign content in it to my body. So that was one thing that appealed to me. And the other thing is that it was subtle. It's not something that I'm going to see a strange and dramatic change overnight, but something that hopefully is just going to kind of reform my facial appearance just nominally so that it's a natural looking appearance. So, that appeals to me, and something that, again, non-invasive. Your reputation, first and foremost. I think that the most important thing to me is the individual who is providing the service, who's administering the treatment, and somebody who I can trust and know has done it multiple times, and I'm not going to be their first opportunity. Absolutely. I think there's, with deepening facial lines, the possibility of introducing something that helps reduce those slightly, whether it's a Botox type of a treatment or a cosmetic filler that gives me a little bit of bolstering in those areas is something I considered. And then potentially some treatment to take out some of the darkening patches that have occurred over the years from sun exposure.